Can statin drugs be more of a hindrance than a help in the battle against heart disease? A controversial question indeed, but one that deserves our attention. Let's dive into the world of medical research, where the effectiveness of statins has been under the microscope. Doctors often advocate for statins, asserting that the benefits of these drugs significantly outpace the side effects. However, Dr. Ravenscoff, in his book The Cholesterol Myths, challenges this assertion. Several major studies conducted up until the year 2000, including the 4S, WASCOPS, CARE, AFCAPS, and lipid studies, showed only minor differences in coronary deaths between the statin group and the control group. More intriguingly, these differences were often statistically insignificant and not influenced by the degree of cholesterol reduction. Two studies, Excel and FACAP-TEXCAPS, reported an alarming trend. More deaths occurred in the statin treatment group compared to their control counterparts. Dr. Ravenscoff's 1992 meta-analysis of 26 controlled cholesterol-lowering trials revealed an equal number of cardiovascular deaths in treatment and control groups, with a higher total death count in the treatment groups. An analysis of all major controlled trials reported before the year 2000 found that long-term statin use for primary prevention of heart disease resulted in a 1% increased risk of death over 10 years compared to a placebo. The Honolulu Heart Program in 2001 supported previous findings of increased mortality in elderly people with low serum cholesterol. The study showed that sustained low cholesterol concentration actually increases the risk of death. The data also suggested that those individuals maintaining a low serum cholesterol over a 20-year period had the worst outlook for all-cause mortality. In the same year, the Miracle study found no change in the death rate compared to controls. The only significant change was a drop in chest pain requiring rehospitalization. In 2002, the All-Hat trial showed identical mortality rates in the statin treatment group and controls after 3 or 6 years. The heart protection study in that same year revealed that the benefits of statins were not as significant as previously thought. The Prosper study also in 2002 suggested that pravastatin did not reduce total myocardial infarction or total stroke in the primary prevention population, but did so in the secondary. In the J-LIT study, there was no correlation between LDL lowering and death rate at 5 years. In summary, while statins have been hailed as a game-changer in the fight against heart disease, the results of multiple studies suggest a more complex picture. The effectiveness of these drugs and their impact on mortality rates remains a topic of ongoing debate in the medical world. While they may offer certain benefits, these must be weighed against potential side effects and the risk of increased mortality, particularly in the case of long-term use. This calls for a more personalized approach to patient care, with a focus on individual health needs and potential risks.